Hi, this is Jonathan Marks from Go2Health Media. This is the second video in our series, How Project 2025 Will Affect Healthcare in the United States. Project 2025 is the Presidential Transition Project, the Conservative Promise, compiled by the Heritage Foundation, a conservative think tank. It's an overall plan that will guide a Republican president if elected in 2024. The project is a 920-page document you can download online. Our video series is based on provable facts to help you make your best choice in the November 2024 elections. In future videos, we'll be covering the following topics of the effects of Project 2025 on healthcare: impact on the Affordable Care Act, impact on private insurance, impact on Medicaid, impact on pregnancy coverage and abortion care, impact on public health programs, impact on rural health care, impact on the healthcare system itself. In this video, we highlight three topics: the major differences in disease and mortality rates in red states versus blue states, household incomes, Medicaid coverages, and state budgets in red states versus blue states, which affect healthcare coverage, and how economic and lifestyle differences affect health outcomes in red states versus blue states. Why are we covering these topics? Because the effects of Project 2025 will differ based upon where you live, and we want to share those differences. So let's first take a look at the prevalence of selected chronic diseases in selected states to see how red states and blue states differ. In this chart, you'll see disease rates in sample red states, Mississippi, West Virginia, and Alabama, versus sample blue states in California, New York, and Massachusetts. In the red states, diabetes rates are 13 to 15% of the population, whereas in blue states they are close to 10%. That's 4% higher in red states. Heart disease correspondingly is about 3% higher in red states. Obesity is almost 12% higher in the red states, quite a difference, and quite significant, as obesity leads to many other chronic healthcare problems. Finally, cancer rates are about the same. These statistics matter because the health system in each state has responsibilities for helping people with treatments for these diseases. So let's look next at the financial capabilities of red states versus blue states in managing healthcare costs. In this next chart, selected tax revenues, incomes, and health costs per person, we take a look at 5 red states and 5 blue states. You'll see 6 columns. The first column is the selected states. The second column is the state tax revenues. The third column is state population. The fourth column is state tax revenues per person. You'll note that tax revenues per person in the selected red states averages $2,500 per person. In comparison, the selected blue states' average tax revenues is $5,200, which is more than twice as much as the red states. In the fifth column, you'll see health costs per person, which is how much each state spends on healthcare costs per person. You'll note at the bottom that spending per person in the blue states is $2,300 more per person than in the red states, which represents 25% more spending. That's not a surprise when we see that tax revenues are 100% higher in the blue states than the red states. Finally, in the sixth column on the right, you'll see median household incomes by state. You'll see immediately that the red states average $64,000 compared with the blue states that average $82,000. That's an $18,000 difference and can have huge implications for the ability to pay uncovered medical costs. This difference also explains the lower tax revenues in red states as well. So let's take a look next at how these differences manifest themselves in healthcare access, outcomes, funding for public health, and social determinants of health. You'll see in this next chart that in terms of healthcare access, red states have not instituted Medicaid expansion as much as blue states have. In the Affordable Care Act, it was originally required that states provide Medicaid not only to households at the federal poverty level of $30,000 for a family of 4, but also to households earning up to $41,400. The Supreme Court ruled that this Medicaid expansion could be voluntary, not mandated at the state level. As of 2024, approximately 50% of red states have adopted the Medicaid expansion, in comparison with almost 100% of blue states having done so. This means higher uninsured rates and less access to preventive and routine care in red states. When we look at health outcomes, we see that red states have higher rates of chronic diseases, such as diabetes, obesity, and heart disease. They have higher mortality rates and lower life expectancy. In terms of public health funding, due to lower household income and lower state tax revenues, the red states have less investment in infrastructure, in services, and less ability to respond to emergencies. Finally, in social determinants of health, those lifestyle factors which affect disease rates and health outcomes, red states have higher rates of poverty, lower educational attainment, lower health education, and lower social safety nets. In conclusion, we can see from this brief analysis that prior to the implementation of Project 2025, red states already suffer from higher poverty, lower social safety nets, lower healthcare coverage, and lower health education, and higher rates of disease and mortality. We will see in future videos that the effects of Project 2025 on healthcare coverage will exacerbate this situation even more. Thank you so much for listening. Please subscribe to and share the videos on our channel. We have more videos coming in this series, how Project 2025 will affect healthcare in the United States. Our goal is to share evidence-based information with the public provided by health experts so that you can elevate your life. This is Jonathan Marks with Go to Health Media.